Welcome back, everyone. Pope Francis remains in critical condition this morning, battling double pneumonia. The Vatican says the Catholic leader had a peaceful rest Saturday night following a respiratory crisis. He's not out of the woods just yet. Here to discuss is board-certified neurologist Dr. Tom Pitts. Doc, welcome back. Good to see you.
Good to see you too, Hena.
I want to start with how the Pope's doing. You're not his doctor, of course, but when treating someone with chronic lung disease like the Pope, what is the biggest challenge?
Well, he is older, and he did have a history of partial lung resection in 1957. So he has a lower respiratory reserve at baseline, and he's a little older, so he probably has some degree of immunosenescence or diminished immune function. To complicate things, he has a polymicrobial, he has some fungi, viral, and bacterial characteristics to his infection. So he needs steroids, which he's getting to dim inflammation, which can help for the bacterial side of things and the viral side, but may inhibit his immune system and allow the fungal component to persist. So I noticed that he's stagnated. He seems to be doing okay, but not really over the hump. And if anybody's listening, while I'm not his doctor, they may want to consider switching out that steroid for something like intravenous immunoglobulin, which will help him bolster his immune activity during this critical phase, rather than inhibit it, especially as it pertains to the fungal component of his pneumonia. The other things to do are keep his heart stable, make sure he doesn't have an arrhythmia from work of breathing, and nurture him, meaning give him supportive care with blood pressure control, nourishment, and hydration.
He's 88 years old. What does treatment look like for double pneumonia for someone his age?
What's interesting, the fact that it's in both lungs, treatment-wise, there's still antibiotics, there's still anti-inflammatories, there's still supplemental oxygen and the supportive care I mentioned, like making sure the heart isn't overworked. But what it really makes curious is rather the mechanism. How did he get double pneumonia? Did he aspirate into the right lung and then have a super infection onto the left side when his immune system woke up to fight that? He could have overconsumed immunologic players and been susceptible to something like a fungal infection. Does he have facial weakness? Is he now aspirating or having trouble swallowing? I hope they assess for that. Could this just be a diminished reserve from having chronic lung disease and a partial resection? So treating it, you still get antibiotics, you still get the supportive care that I talked about, but then you got to double back and say, how did we get here at double pneumonia? And you have to think about the things I mentioned.
And of course, we'll continue to monitor the updates for the Pope. Let's shift gears here now, Doc. COVID vaccines were crucial in immunizing America. There's a recent study, however. It found it could also lead to a rare condition presenting itself in some people. We're seeing it following after they got vaccinated. Can you explain the findings and, of course, the symptoms we should all be looking out for?
Yeah, Hena, and I work with neuroimmunology intimately. Just last week, I'm treating ICU patients, myasthenia gravis, which is an autoimmune neuromuscular disease. These are patients on ventilators, Guillain-Barré. And so this is kind of my forte. And so reading this, I'm not surprised to see that they found long-lasting spike protein. But the problem with the spike protein, I hope they don't focus too much on that, because the spike protein, right, we should form that to some degree. You should get somewhat ill when you get a vaccine. That's how your immune system wakes up to form an antigen. But in people that are predisposed to autoimmunity, especially, they make a self-antigen that mimics, it's called molecular mimicry. It looks just like the spike protein, and they have prolonged autoimmune responses. So the answer here, Hena, is really to take this data and say, all right, we know that. We know that people have prolonged autoimmune responses to vaccines. The problem is, if you have an autoimmune disease and you get it, you're at a higher risk to have a prolonged or systemic problem with the vaccine. The other problem with that is that the other side of the coin is, if you don't get it and you get the illness, you're also at risk to have a higher proclivity to a higher or more complicated mortality rate and intubation rate. And I'll just add, that we have to get better at screening. That's the key. Before going into a vaccination, we should be pre-treating people with autoimmune disease and autoimmune antibodies, just like we do, as I mentioned before, with intravenous immunoglobulin. We give people antihistamines and things like that, even steroids, low dose, to blunt the immune response so that they form an antibody, but they don't have an overwhelming immune response. And that is what this is showing. These vaccines save some people and they hurt some people. That is the true answer, Hena. That is the real truth. They hurt people to some degree in the course of protecting them who have a proclivity to autoimmune response. The other side, now the problem there is, you say, well, if we didn't vaccinate them, they would have had a horrible response to the illness anyway. The other side of the coin is you say, well, they may not have ever gotten the disease, so how do I know? That's a very tough call. But I can say that it also saves lives by coordinating an immune response in most people.
Yeah. Thanks for watching. Go to joinnn.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.